Hello, and welcome to this course on Health, Environment and Development. My name is Linda Waldman. I'm a social anthropologist who's been working on health, environment and development for the past 11 years, and I'm the convener of this course. We are living in exciting and challenging times. Climate change continues to vex us. The world's population is expected to increase exponentially. We are witnessing massive urbanization, and we have become all too familiar with pandemics as diseases such as SARS, Ebola, Henipa and avian influenza affect us. All of these things place massive pressure and will continue to place pressure on water and food resources, as well as on sewerage and solid waste. We will need to increase the numbers of animals to feed all the people, as well as find places to keep these animals. Changes in urbanization and the rise of peri-urban settlements will force people, domestic animals and wild animals into closer and closer interaction as they share spaces of habitation. Massive movements of people across the globe will also raise questions of infectious disease importation. New development paradigms have emerged in response to these challenges. These include the One Health Initiative, which seeks better integration between human and animal health, the Sustainable Development Goals, or SDGs, which comprise of social, economic and environmental goals for 2030. Amongst these 17 goals, several address health, environment and development and the interface between these. Both health outcomes and environmental sustainability are integrated throughout, with linkages to other goals and targets. And this reflects the integrated approach underlying the SDGs. There is also much discussion about planetary boundaries and about the pressures on our planet, about finding a safe operating space for humanity, where questions of sustainability can be addressed alongside issues of inequality. These global discussions and initiatives point to the ways that ordinary people's experience of health is deeply integrated into the environment in which one lives. This is not a new insight. It is now widely acknowledged that health outcomes and health equity are profoundly affected by the social determinants of health, and that this has knock-on effects for development. This course takes the social determinants of health as a starting point, but broadens these out to include environmental and political drivers of ill health. It emphasizes a political economy approach, with a strong focus on socio-cultural norms, understandings and behaviors, and how these might intersect with institutional processes such as policy, governance and regulation to impact on health and development. So why have I bothered to convene a course on health, environment and development? Cairncross and Kolsky point out to us why health, environment and development are so interrelated. They tell us that poor people often live in the worst environmental conditions, that the burden of environmental disease falls primarily on poor people. They are more vulnerable to and often more exposed to environmental disease, and they have lower resistance to infection. People living in poverty often also have to pay more for health services and for basic services such as water. Ill health always reinforces poverty. When people living in poverty fall ill, they lose income, may lose their jobs, and become indebted because of the cost of health care. Ill health and disease also stunts growth and intellectual performance. Improved environmental conditions can do more than enhance health. They can reduce time commitments, living costs, and the burden of daily life. They can increase security and dignity, and through service provision, increase convenience. These improve health, but also improve productivity and economic growth. We can also see this effect in the interrelatedness between health and environment in statistics. The lack of access to clean water and sanitation and indoor air pollution are seen as the two principal risk factors of illness and disease, mainly affecting women and children living in poverty. Every year, 5.4 billion cases of diarrhea are recorded worldwide, resulting in 1.6 million deaths, mostly amongst children under the age of 5. About 2 billion people are affected with intestinal worms, which thrive in poor sanitary conditions and amongst the world's poorest communities. This infection can lead to malnutrition, anemia, retarded growth, diminished performance at school or work, depending on the level of severity. In low-income countries, more than 147 million children under the age of 5 are chronically undernourished or stunted, and more than 126 million are underweight. And the list goes on. There's indoor air pollution, HIV and AIDS, antimicrobial resistance, pandemics. These statistics remind us that when considering the interconnections between health, environment, and development, the most affected populations are low and middle income countries where people live in conditions of extreme poverty. And these populations are spread across urban areas, peri-urban settlements, and rural communities. There has been, over the past 2 decades, increasing awareness of the need to address health, environment, and development in a coordinated way. A wide number of international organizations and events have recognized the importance of the natural world in shaping health outcomes. In 2012, at the United Nations Conference on Sustainable Development, known as Rio+20, health was recognized as a precondition for and an outcome and indicator of all 3 dimensions of sustainable development, namely economic, social, and environmental development. There are, however, many definitions of sustainability, and this is a highly contested term. Does sustainability refer to a city and the city's use of natural resources, or to rural communities, or the combination, or to the management of natural resources for all economic development? In this course, and drawing on the work of Leach, Schoons and Sterling in the STEPS Center, sustainability is used to refer to environmental integrity, to social justice, and to poverty reduction, as well as to the specific ways in which different people define sustainability for themselves in a wide range of settings. For this reason, sustainability is fundamentally linked to political power, to processes of decision-making, and to choices. The environment itself is a difficult concept to understand. Lindheim and Syme see the environment as consisting of the natural, social, built, and symbolic environment, but go on to say that it is none of these things independently. Rather, the environment is a result of the constant interaction between natural and man-made spatial forms, social processes, and relationships. The environment is not, as many assume, everything outside of people. In fact, people do not exist or interact in limbo, but are in specific places, which they in turn modify by their presence and their activities. People are an essential part of the environment. They are as real as trees, rocks, or skyscrapers, and their interactions with each other and places can significantly affect their health and that of others and their well-being. The relationship between environment and health is not simple, and it is not linear. The same environment can mean different things to different people, depending on age, background, work, conditions of life, etc. The recognition that human health is affected by a range of interrelated environmental factors and processes, and that humans in turn can affect and shape the environment through their actions, represents an ecological way of thinking. In this ecological view, humans are inseparable from nature, and human health is a result of this interdependence. Our understanding of this ecological complexity has evolved over time, starting from the general understanding that the environment is linked to and affects health, and ending with the realization of sophisticated ecological interdependencies between the natural environment and human health. Public health, health systems, vaccination, antibiotics, improved diets and standards of living, sanitation, food safety regulations, etc. All of these have contributed to improved health status for many people in the world. There has been undeniable progress in addressing health, environment, and development, but the benefits of these innovations have not been available to everyone, and there are enormous differences in health statuses and disease patterns across the world. This course explores why these differences persist and asks what might be done to address it. This course starts by discussing some of the key topics of public health: environmental health pollution, mining and occupational health, the built environment, sanitation, and vaccination. In all these lectures, it shows how the environment, broadly conceptualized to include physical, ecological, and biological determinants, in conjunction with socio-cultural, economic, and political factors, influences people's experience of health. It shows that, when contextualizing these topics in relation to questions of the environment, development, citizenship, and policy processes, these seemingly straightforward health topics are always controversial, uncertain, and often contested. In these sessions, the primary focus is on human health and development outcomes. In the later sessions on zoonoses, emerging diseases and structural violence, and on emerging diagnoses, the course draws on political ecology perspectives to provide an enhanced understanding not only of environments, but also of the reciprocal interactions between human health and environments. In emphasizing these social science perspectives, particularly political economy and political ecology approaches, the course examines what drives health-related behavior, how this shapes policies and programs, who benefits and who loses from the many different kinds of health and environment interventions, and the implications of this for development. This includes an awareness of different sectors of society, of diverse interests and incentives, and of power relations. In addition, the course displays an appreciation of the multifaceted nature of development challenges and the consideration of policy, governance, and regulation as they relate to environment and health issues. Throughout the module, critical normative questions about whose preferences matter, who defines the criteria for examining a problem, and how different people engage in the issue are posed. This course comprises 10 lectures, including this introductory lecture, all of which can be listened either as standalone sessions or to be taken as part of a complete course. If you decide to complete the entire course, including the exercises and the essential readings, then I hope that you will have achieved the following. You should be able to demonstrate a sophisticated understanding of environment and health issues and the development implications of these for low and middle income countries. You should be competent undertaking critical assessments of key theories and debates in the literature relating to health, environment, and development. And you should be able to investigate distinct areas of health, environment, and development, constructing an academic argument based on secondary sources. You will be working on these sessions on your own, but remember that these are important challenges that we all struggle to understand. Your endeavors are part of a global network of academics, practitioners, activists, and ordinary people who are all struggling to find better ways of living in this world and enhancing both human and natural health. I hope that you enjoy this course and that it takes you partway along this journey of understanding, wisdom, and future action. Thank you for listening.